Gabapentinoids, specifically gabapentin, which is your Neurontin, and pregabalin, which is your Lyrica, are increasingly being prescribed for pain as alternatives to stronger pain medicines. You know which ones I'm talking about. But the research behind doing that is very limited. The reality is gabapentin is being taken by millions of people despite little or no evidence that it actually can relieve their pain. That's the issue, and we should definitely discuss it. So it was initially approved 25 years ago to treat seizure disorders, but nowadays you'll find it prescribed off-label to treat all kinds of pain, acute and chronic, in addition to hot flashes. But why is that an issue? Well, it's an issue because off-label means that a medical provider can legally prescribe any medicine that has been approved by the FDA for any condition, not just the ones for which it was approved, as long as it makes sense. This can leave patients at the mercy of what their doctors think is helpful. Now, I'm saddened by it because it becomes a patient's job to try to figure out if it's both safe and effective for their particular condition. Take a look at this chart of all the randomized control trials for the gabapentinoids and pain. The positive trials means that gabapentinoids, both gabapentin and pregabalin, were superior to the placebo. If you look carefully, most of it is actually negative, or there are few trials. In some of the trials, patients on a placebo tended to report 1/3 to 1/2 the pain reduction benefit of patients who took gabapentin or pregabalin. In other words, the placebo did a better job. There's now also a third medicine, gabapentin incarbol, which is sold as Horizont and is approved only for restless leg syndrome and post-herpetic neuralgia, which can follow a shingles outbreak. But gabapentin and Lyrica, both sold by Pfizer, have been approved for only 4 debilitating pain problems: post-herpetic neuralgia, diabetic neuropathy, fibromyalgia, and spinal cord injury. But even for these, the evidence for relief is not all that much. I'll give you a quick example. In the New England Journal of Medicine, for the trial of pregabalin for acute and chronic sciatica, which took 209 patients, treatment with pregabalin did not significantly reduce the intensity of leg pain associated with sciatica and did not significantly improve other outcomes as compared with placebo over the course of 8 weeks. What I actually found interesting was, if you go on the Department of Justice website, you can find Warner Lambert, who was a producer of the Neurontin at the time, had to pay $430 million for aggressively marketing Neurontin for all sorts of pain relief. This marketing campaign resulted in sales of over $2 billion a year before its patent expired in 2004. This is why you have doctors who may have bought into this marketing back in the day. And if you actually take a look at the number needed to treat, which is the number of people who need to take the medicine so that one person gets better, the combined number needed to treat is 7.7 for pregabalin and 7.2 for gabapentin. But this can be as high as 22 in painful diabetic neuropathy, which means if you treat 22 patients, one of them will respond for pain control. And it's not just a few people taking it, right? In the New England Journal of Medicine, just in 2016, gabapentin was the 10th most commonly prescribed medication in the US. 64 million gabapentin prescriptions were dispensed, up from 39 million in 2012, with brand name pregabalin ranked 8th. And I could see why it's not their fault. Think about it. We know it works to control seizures by dampening the transmission of neurons, right? Well, pain transmits to the brain with these same neurons, so it's not outlandish to think if you can dampen down the neurotransmission, you can also reduce the pain sensation at the same time. But the only pain that gabapentin is currently approved for is nerve pain caused by a herpetic flare-up. Pregabalin is a lot more broad, as it's tailored for diabetic peripheral neuropathy, fibromyalgia, and nerve pain associated with a spinal cord injury. But even that can sometimes be hit or miss. Technically speaking, this should be used primarily for nerve pain. So if you're getting a burning, sharp, static, tingling kind of pain, you can make a case for it. But if you're using it for low back pain or chronic pelvic pain, it's probably not the best use of that medicine. And gabapentin does not work for everyone. If you do not feel any improvement in your pain after 6 to 8 weeks, do not suddenly stop taking the tablets, but speak to your doctor first. You need to speak to your doctor about how to taper off this medicine. It's really important that you do, and you don't stop taking it abruptly, especially if you've been on it for longer. You need their help with getting off of it. Plus, there is still potential for misuse. Pregabalin is a Schedule 5 and gabapentin is considered a Schedule 5 in some states. And before wrapping up, I also wanted to highlight another reason why you see so many prescriptions for it. The American Family Physician website makes a good point. The O crisis has likely resulted in undertreatment of pain when physicians have substituted other medicines, including gabapentinoids, that might be less effective in a given case. Because physicians are feeling intense pressure to avoid O prescribing, they may be withholding O's from patients who have used or will use modest doses responsibly and effectively. And guys, I'm using the word O because YouTube doesn't like the full word, but do you see why that pressure is there? The O crisis is a real problem we have. And there's always this background risk to the doctor's license when they prescribe them and how many they prescribe to. Gabapentin is just an easier script to write off. The biggest thing I want you to take away with all of this is if you're on any type of gabapentinoid, find out why you're exactly taking it. How long do you need to be on it? And what is the lowest dose you can take to provide an effective response? But I'm more curious to hear from you guys. I just wanted to make this video and rant about this issue since I think the message is important and more people need to know. Let me know what your thoughts are down below. Hit the like button if you found this video useful, and I'll see you on the next one.